My name is Paul Urbanek, and I work in the Concord Orthopaedics, Pediatric Orthopaedics, and Spinal Deformity. My offices are in Concord and in Derry, New Hampshire. My education really started at the University of New Hampshire, and I'm a proud graduate from that school and glad to be here in New Hampshire helping promote UNH. I was a chemical engineer there, and actually my first job was doing engineering. However, I then went to my original interest in life, and that was to be a doctor, and then it took another 12 to 15 years after my education as an engineer to get the skills that I have now, and that includes work at the University of Cincinnati, both a master's degree in chemistry as well as my medical school, and then also at Brown University at Rhode Island Hospital I did my residency, and then finally a Pediatric Orthopedic and Scoliosis Fellowship at Texas Scottish Rite Hospital in Dallas. No matter how important somebody's education, it's really the experience that I bring to my patients in practice. And that includes 22 years of practicing pediatric orthopedics and spinal deformity. This included 5 years at Dartmouth-Hitchcock as a staff physician there for the first job, and then for the last 18 years at Concord Orthopaedics. I chose pediatric orthopedics because I like to work with kids. They provide a challenge as to their parents who are concerned and grandparents that are concerned about the children that they care for and are worried about. So I try to communicate with everyone involved. That can be fun, it can be challenging, but it is what I do. And I like to think of myself as being able to do that well. They have also diverse pathologic problems with their bones and joints. That might include scoliosis, might include hip dysplasia, club feet, hand and forearm problems, fractures, things that they were born with, some things that they develop later. And it's really for the treatment of that I have devoted my professional career. My practice philosophy is really to treat the whole person. And that whole person includes the family, it includes the patient. The age of the patient obviously has a big bearing on how I might approach it. An infant whose parents are making all the decisions for him or her really doesn't have a say, but I try to provide compassion to everybody in those types of situations. A teenager often wants to make the decision himself or herself, and often obviously the parents are still calling the shots, but I try to engage the patient with as much responsibility as they want and can handle. So I try to individualize in that regard. My interest in pediatric orthopedics, I would say my biggest interest is in spinal deformity, and that would be scoliosis. And I've really enjoyed that part of it. It's both the surgical and non-surgical treatment of scoliosis. That can include just observation with x-rays periodically. It can include bracing if it's necessary, and then if the curves reach surgical proportion, it's doing their surgery as well. However, one of the beauties of pediatric orthopedics is that it's a diverse set of problems that can be from the fingertips to the tips of the toes to everywhere in between. And I like that diversity and not just concentrating on one joint, for instance, or another. Hobbies are my own children, and I've followed their sporting events. They're all now in college. In fact, all three are in college this coming fall, and that's been a challenge of its own. We love the ocean, and we sail and motorboat and fish and all kinds of things. We ski as a family, and we've enjoyed that togetherness and also the challenges of those sports.